This is a special 17 News Break.
Good morning from the 17 Newsroom. I'm Alex Fisher. We are breaking into programming this morning to give you the latest on the coronavirus cases here in Kern County. We're expecting to hear from public health officials in just a moment about the latest results from those tests, those hundreds of tests that are still awaiting results, and of course the confirmed cases in Kern County. Let's kind of just recap what we know at this point. We do know that at this point there are 25 cases confirmed in Kern County. We do know that 24 of those are residents, and then of course, if you remember, on St. Patrick's Day we had our first case confirmed, but that was a woman from New York. So public health officials are trying to make the distinction and say that there are 24 residents in Kern County who have the virus, as well as one non-resident, and all of them are recovering at this time. Again, there are still more than 400 tests that are still pending right now. We do know that more than 500 tests have been processed and have come back as negative. So again, there are 411 tests as of the last update from public health officials, saying that we are still waiting for results for those tests. Now again, public health is giving us updates every day on the latest on the coronavirus and how it's impacting people here in Kern County. On Mondays and Thursdays, they do a live briefing giving us the latest. And so we are waiting from public health officials. Let's take you live there as we prepare to hear from Michelle Corson, who will give us the latest on the coronavirus here in Kern County.
Officer, and I am here to provide an update, and then we can get to some questions at the end. Before I get to providing the updates, we really just want to extend our appreciation to our community for staying at home and practicing the common sense approaches to staying safe right now. So washing our hands, staying home. If you do go out, practicing social distancing. We know we are working hard as a community to achieve this, to keep ourselves well and healthy, and we just really want to thank everyone for the effort that they're making, because we really have the power to slow the spread of COVID-19 if we are all practicing these things. We also want to remind you that we are in ongoing communication with the California Department of Public Health, the Centers for Disease Control, and we are getting updates regularly and resources so that we can funnel that back into our community, to our partners, and this is something that we are doing constantly, and we just want to remind our community that that's happening every day, 24 hours a day, basically, at this point. So to touch on some of the data, the current data, the California Department of Public Health reports as of March the 24th at 2 p.m., there has been confirmed 2,535 cases of COVID-19 with 53 deaths in the state of California. 28 Kern County residents have tested positive for COVID-19 and one non-resident. And I'll need you to refer to our map that will be updated online very soon as to the new additions of those cases, what regions they fall in. Of the tests that are being conducted for COVID-19 in Kern County, we are aware of 952 tests, 553 are negative, and 370 are pending at this time. We also want to assure our residents that we investigate cases throughout Kern County. We look both where the cases may have been exposed and also where they potentially may have exposed others in our community. We continue to investigate all cases and their close contacts. If it is a relevant community exposure that is identified, we will notify our community immediately. But we are working with these identified cases, their close contacts, and this is something that our epidemiology team is doing on a daily basis. We just want to assure our community of that. There is some new guidance that has come from the California Department of Public Health regarding testing. And what I'm going to kind of just go through this right now to outline it. Testing based on medical needs will ensure that people who most need testing can get tests rapidly and reduce the strain on our healthcare system. Who should be getting tested? According to this new guidance, hospitalized patients that have signs and symptoms of COVID-19, residents and staff of long-term care facilities that have signs and symptoms of COVID-19, those at high risk of severe infection with symptoms of COVID-19, residents and staff of correctional facilities and congregate settings with signs and symptoms of COVID-19, and healthcare personnel with signs and symptoms of COVID-19. Who should not be getting tested under this new guidance? Those that are persons with mild respiratory symptoms who do not otherwise need medical care are not in one of the above mentioned groups. These people should care for themselves at home. Also, asymptomatic persons should not be tested for COVID-19. Sick people should stay at home and away from others until there has been no fever without the use of fever-reducing medications, and there has been an improvement in respiratory symptoms for at least 3 days, and it is at least 7 days since the first symptoms appeared. So these guidelines have been sent to our healthcare community through our healthcare bulletin that is posted on our website currently. And finally, I want to address our monitoring program. This is something we talked a lot about prior to getting positive cases. Our monitoring program were those travelers that made it through one of the 11 airports that had been in an area where COVID-19 had been circulating. We were provided those names of those individuals to assess them and monitor them to ensure they didn't develop symptoms. So as of March 18th, the state stopped collecting information about California travelers. All of the travelers that had been in our monitoring program are no longer needing monitoring, and therefore the monitoring program has stopped in our community. And I'd just like to close reminding everyone to please visit our website. We are working diligently with our team to keep that updated with all of the new guidance that's coming down really every single day. And of course, our call center is open 7 days a week, 8 a.m. to 5 p.m. We are getting lots of calls. We want our residents to reach out to us if they have questions, and our partners. So just a reminder, our call center is here. And with that, I am very happy to take your questions.
So the cases went up by 8 yesterday, which is a pretty big jump. Can you confirm if those 8 were part of the same household or related in some way, or are they all separate cases?
I don't have that information.
Okay. You said, when someone does test positive for COVID-19, you identify their close contacts, where they've been. How would you disseminate that information? Like, let's say this person had been to a wedding, in the past, few weeks. Would you notify everyone from the wedding? Like, how does that work?
Yeah, so these are great questions. And we are going to take an identified case, and our epidemiologist is going to make contact and start talking through where have you been. A lot of the factors come in when you were symptomatic, who have you been in close proximity with, things like that. And once they do that determination, they will reach out to individuals that have been in contact with this positive case to make sure that the appropriate steps are being taken. So I hope that answers your question.
I guess I'm wondering, what about public places? I think a lot of viewers are saying, oh, what if you were at Trader Joe's at the same time I was there as well? Will the entire grocery store be notified? Something like that. Yeah,
so if there is a risk, this comes into the close contact. So if we're all practicing our social distancing, which we should be, and we're in a grocery store, then there may not be a need if if there was a case that was walking through a public space. There are many factors that play into that, but after our epidemiology team assesses it, and if they feel like there was some close contacts, they're going to reach out to those individuals. And if it was a gathering of people, then yes, we would make a public notification if we felt like the community was at risk.
Looking at that map, why are there so many cases in Bakersfield West? Do you have a general idea?
We don't. This is very early on. These are great questions. I think over time, patterns may develop. The way that testing has surfaced and where the testing's happening, there's just so many different factors playing in. So right now, there's really no way for us to answer that.
If there was a spike in an area like that, would you consider closing some of the major parks in that area just as a precaution? If one was determined to have been in that area?
So if we were to determine, a cluster of some sort, and this is something, that our epidemiology team would be working on, if we had to take greater steps, we would take those steps. We're not there yet. But yes, protecting our community is the number one priority. And if we saw a pattern developed, we would take the appropriate steps.
And regarding tests, did you guys anticipate more people coming forward to try and get tested, or was this kind of a nice steady flow that you guys have had? Because we have been talking about the way we have, and because we've been telling people, how and when they should be tested to make sure that, people over here on this side of town are not getting, or maybe will have more access to health care, and maybe on the other side don't.
Yes, testing has been quite a topic of conversation. The new guidelines have come out, and they're pretty strong, and we're wanting to recommend that truly testing is reserved for those individuals that need it. If you have mild illness, you do not need to go be tested. You need to stay at home. And so when it comes to the testing, it's becoming more broadly available. And so who is getting tested and why, I can't really answer that. Clearly more testing is happening. We just hope that our healthcare providers take the guidance, because ultimately they're the ones making the decisions of who is going to be tested and who isn't.
Can you go a little bit more on why you guys decided to release the map instead of the ages? Considering that you guys had an option based off the guidelines that you guys pushed forth, why did you guys really decide to release the map instead of the ages?
So it's similar to Valley Fever. For those of you that have been we hold a press conference for Valley Fever every year where we release that data, and we use a similar geographical pattern for that data release. Once we start getting more cases, we're going to be able to look at elements like age, sex, and different elements that we could release about positive cases to our community. So it's just a determination that we have made with these diseases to start to paint a broader picture. But at the end of the day, us staying home, us practicing the measures that we've been asked to practice, the geographical information isn't essential for us to know to protect ourselves at this time, quite frankly.
So basically you guys don't have enough data right now? Is that what you're saying?
Exactly. So there's a decision tree, is what I call it, that our epidemiology team goes through with guidance from the California Department of Public Health. We've just posted a video to our website that kind of breaks this down for folks. And so based on that guidance, we are able to, once you hit another threshold of an amount of cases, I don't know what that is, they could begin to weave in more elements.
So just to piggyback off that, is it possible to release the number of tests being conducted in those regions? What's the west side? Okay, we've conducted X amount of tests in this region, and we've conducted X amount of tests in this region. Is that possible at this moment in time?
For us, it's not. Right now, we are asking, and it is mandatory for these tests to be reported to us. But so we are hopeful that we are getting notified of all of these because they're supposed to be doing that. But we don't have enough of the detailed information at all of the testing sites that have started to be able to paint a picture for you and give you an accurate data set that would...
So, and then the other counties that are a little bit smaller than Kern County, for example, are releasing both ages and location.
Yeah, so I really can't speak to other counties. What I can say is we take the guidance set by the state very seriously, and we intend to follow it, and we also intend to release as much information as we can when we can to our community.
Where do you think we are on the curve right now? I know that they were saying that they expected cases in California to double every 5 to 6 days, but it's actually doubling every 2 to 3 days. Is that something we can expect to see here? Where do you think we are in terms of flattening the curve locally?
That's a great question, and I don't have an answer. It's something we're evaluating. We're looking for more guidance to do modeling. What I can say is what we're doing now is hopefully flattening the curve. I mean, these actions, these interventions of staying home and practicing social distancing, this is the moment where we can make that change and hopefully not get to a peak. So I don't have a good answer for that right now, but it is something we are assessing and evaluating, and if we can provide any information on that, we will.
How prepared are our hospitals for a possible onslaught of cases? And we have enough ventilators, and I know PPE is always a concern, but where do we stand on that?
So the great thing about our hospitals is weeks ago, before we had these big press conferences going, we started meeting with our hospitals, our schools, and we have these emergency protocols in place for just a time as this. So we feel confident that we have plans in place. We are in ongoing communications with our hospitals. And so at the moment, there is no indication we wouldn't be prepared. We will expand as needed, but those planning discussions are in place. Was there a second part to your question? I'm sorry.
Just personal protection equipment in terms of preparedness for that.
And ICU beds, just to piggyback.
So at this time, we receive regular requests from our partners for PPE and any needed equipment. We are filling those requests on an ongoing basis, and when we start running low here at the local level, we request from the state. We got another delivery, a shipment just yesterday. So the flow is working for us here in Kern County.
I think a lot of viewers are worried too. They're hearing that it's going to become like a seasonal thing. Like even if we get this under control by June, it might reemerge in October or November. I know obviously you're not psychic, but what are your thoughts about that? Is that a possibility?
Of course it's a possibility. The thing about the novel coronavirus is it's novel. They're looking at other coronaviruses and the patterns they have had, or the seasonal flu, for example. So there is a lot of work being done right now to try to determine, but it's so early on. So I think one would hope that, especially here in warm Bakersfield, that would be the case. But at this point, there's just the CDC has not come out, and we follow their guidance on that. So I think for now, it's wait and see how this develops. We're going to know a whole lot more after the research is done, months down the road from right now.
What about someone who might think they just have another illness that's not COVID-19, but obviously a lot of these sicknesses, the symptoms can overlap? What would you recommend for them? Just stay at home? What if they do need medical, they need medical treatment? Should they go to the ER, or what's the kind of protocol for that?
Yes, so for anyone, we are still in flu season, and we have, things like valley fever here in Kern County. We want to remember there are other illnesses that we all need to be mindful of. So if you're experiencing illness that is ongoing and you're not able to take care of it at home and the milder symptoms begin to elevate, call your doctor is the preference, and kind of talk that through with them. But when you need to seek medical care, you certainly should, and that's down to every individual and what they feel is going on with themselves. Of course.
Hospitalizations?
I'm sorry?
Hospitalization?
Oh, sorry.
You sure? Okay. Yeah, so
and then you're next, Karen.
Yeah, sorry. How many hospitalizations right now in terms of the people who have tested positive or maybe even still under surveillance? I mean, do you have that number?
I don't know. I don't have that information.
You don't know how many COVID people are actually, because we know that most of these people were recovering at home. Have any of the more recent ones been maybe more severe where they required medical attention inside of a hospital?
I don't know. What I do know is if they're identified, so many of our investigations are ongoing, if they have tested positive, they will either be in isolation at a hospital or at home. So I'll have to get back to you on more definitive numbers.
Okay, and then just, sorry, Karen, one more. So where when we go back to the travelers a little bit, you know, you guys are monitoring 30 travelers. Of those cases that have come back positive, were any of those people the travelers?
Not to my knowledge.
All right, and then do you think that this move by the state to no longer release the information to Kern County about the people who have been traveling in and just to decide, okay, community spread is what's happening, do you think that does Kern County Public Health really think that that was a good idea in terms of benefiting us trying to slow the curve, or do you feel like having that knowledge of everyone who's coming in our gates is really essential to making sure that community spread is not, you know, more rampant? So, do you, what's the response from
you know,
the public health?
we support the decision. We understand the need for the monitoring program when it was there, but things have evolved, and now as a community, we have cases, and we need to be taking the same precautions we would be doing regardless. So I guess my answer to that is we have moved to a point with the social distancing and all the communication we've been giving to the community that we weren't giving earlier on because there wasn't a need for it. Now that is adequate. So whether you're a traveler or you're here in this community, no matter the situation, if you are practicing the stay at home, that's going to take care of kind of all of those elements. Does that make sense? Yes. Okay. Karen.
That one desert case that we received recently, can you confirm if that's the one at Edwards Air Force Base?
I can't confirm that.
Okay, and in terms of the situation with testing, you know, President Trump said a few weeks ago that all testing was going to be free. You know, that's not exactly the case from what we've heard from our viewers. Is there a generic, uniform pricing for testing that all these sites have been offering? Is it really free?
I don't know. It's ever evolving, and every site is different. And whether you're on Medi-Cal or whether you're insurance, there's so many variables. There's been so many. I know there's so many things coming down the pike to try to alleviate the costs. So I know we are exploring that and trying to get as much on that topic on our website. But that's about as much as I know at this point.
I was going to say, how much of a fear is that if I'm very low income and I might have symptoms, I might be, even if the testing is free, I've seen articles that someone paid like $35,000 for their COVID-19 hospitalization, not in Kern County, but somewhere else. That could cause a lot of people to be in fear, right? And that's kind of, they're still going out or whatever, and that kind of defeats the purpose. So how much does that play into our, I don't want to say worry, but our decision making?
Yeah, and I completely understand the question, and I don't have the information out at the sites. You know, some of the folks that are doing the testing and the providers could probably better answer that. I know over time we continue to hear of the resources coming down. I know the governor has made an effort to make testing more affordable and widely available. So we will continue to get the information on our website so we can better distribute that. But those are great questions, you guys.
There are so many cities and counties that say they have run out of either ICU beds or ventilators or tests or PPE, and you know, you've repeated over and over that we don't lack any of those. But are we prepared for a potential exponential growth like New York City has seen or LA has seen with that equipment that we have? So
we currently, I'm unaware of any shortages of those things in our hospitals, and I know they've got their plans of expansion. Like I said, this is something that we practice for, we're ready for. We have extra supplies on hand as a public health department to support our hospitals in a time like this. So as this moves on, the conversations are happening now of, as we continue to have to grow, if we do, what does that look like? And securing those resources as we need to grow is what we would do.
So I just have, sometimes we have to push for questions and answers. Obviously, you're press conferences, but I don't want to stray away from getting an answer to this question about the hospitalizations. Because
Okay.
I've stood here in the different press conferences and I've understood the protocol that you guys take when making contact with a resident who may have tested positive. You guys have told us why you guys wait 10 hours to tell us because you have to make contact with the individual.
Yes.
And then you have to find out where they went. So when I asked you the question about how many people are in the hospital and are in isolation in the hospital versus how many people are isolating at home, why is that number not clear to the Kern County Public Health Department right now when a few weeks ago we knew 8 people were at home?
And you're right. I simply don't know the answer. So what I can commit to you is I will follow back up and give more information. I just simply don't have it. More and more cases have come in at a very high rate. Obviously, just the last couple of days. So I just simply don't have that number for you.
Okay.
Of course.
Yeah, no, I totally understand. I just wanted to make sure that
Of
part
course.
was clear, that we can get that number later. And then the guidelines. This is my last question.
Sure.
The guidelines in the sense of, what the guidelines you guys are following. We haven't been able to find that on your website. Is there a way you could send that to me? The guidelines
Yes.
you guys are following?
So it's like a 65-page document that the state, so yes, I can definitely do that.
Are you guys also planning on posting it again to the website just to ensure everyone
Okay.
has access to those guidelines?
Yes.
Okay.
And to be fair, there's been a surge in cases recently, but this is something that we expected. As the testing rolls out, we expected to see more cases. It's not necessarily that the numbers are exploding, it's just that we have more information. Is that fair?
Yes. I don't know, you may need to ask the question again. I'm sorry, Tim.
I mean, we had 3 cases last week, but we didn't have nearly as many tests. And
Oh,
we were behind
yes,
the ball on getting
absolutely.
testing. So this is kind of, the numbers are going to continue to rise, but this is something that's expected. It's not necessarily meant to panic
Correct.
the public. It's
Yes.
that as we get more testing in, the numbers are naturally going to rise.
Yes. So we shouldn't be alarmed by this. We should pay attention to it. But as our testing has expanded, obviously that is going to increase the potential positive cases. So with all of the actions we're taking, with the stay at home and all of the social distancing, the hope is that we keep that as low as we can. But it absolutely would assumingly be correlated for sure.
And regarding schools, I think you guys were kind of part of the discussion when they made the decision that schools would resume closer to the beginning of May. What's that rollout going to look like? I mean, if we're being optimistic about this whole thing, as far as businesses and things like that go, as far as being able to open, will businesses come back out 2 weeks before the schools come back open? And do you guys have any kind of input on that timeline?
So yes, in regards to the schools, we have been in constant communication with our superintendent of schools and school districts on these very important and difficult decisions they've been making. So yes, they came out with the new announcement that it's going to be extended. I think right now the answer of much of this is we're following what the governor has ordered and issued when it comes to the stay-at-home order and the businesses that should be operating minimally, the essential services. So a lot of it's going to depend on the state guidance that we receive, the timeline to that, and just how this continues to evolve in our community, what is the amount of cases we're seeing, things like that to make those decisions. So at this point, it's hard to really give a time frame